Hello and welcome to the health program on Trust Television. I am Aisha Salihu. On this week's episode of Healthy Living, we're joining the rest of the world to mark the 2024 World Neglected Tropical Diseases Day, which was recently celebrated. And this brings to the fore the importance of re-examining these categories of diseases, especially the vector-borne diseases, neglected tropical disease. According to the WHO, vector-borne diseases account for more than 17% of all infectious diseases, causing more than 700,000 deaths annually. They can be caused by either parasites, bacteria, or viruses. These viral diseases transmitted by vectors include malaria fever, dengue fever, chikungunya fever, Zika virus fever, yellow fever, West Nile fever, Japanese encephalitis, all transmitted by mosquitoes, but tick-borne encephalitis transmitted by ticks. Although experts say many of these vector-borne diseases are preventable through a protective measure and community mobilization. Now let's learn more about these diseases that affect 1 billion people worldwide. In parts of Africa, dengue fever has been more prevalent, especially in Burkina Faso in 2023. Nigeria had its fair share in December 2023, recording an outbreak in northwest Sokoto State. We now have joining us virtually Dr. Bello Arkila Magaji, who is a senior lecturer community health, Usmanu Danfodio University, Sokoto, to explore further insights and perspectives on vector-borne neglected tropical diseases, and most especially dengue fever. Welcome to the program, Doctor.
Thank you very much.
Now, you heard my introduction, and we have been talking about neglected tropical diseases, especially vector-borne diseases. Now, let's just as a backgrounder, what can you tell us about vector-borne diseases, and do you agree that they have been neglected?
Thank you very much, and thank you for the invite to attend this program. Vector-borne diseases are simply diseases that are transmitted to humans via an intermediate. That intermediate is what we call the vector. And a number of them affects humans, either directly or as a result of human interaction with animals or other sources of infections. They are regarded as being neglected because the attention those diseases requires is not being put in place by a sizable number of countries in the Committee of Nations. And as you rightly said, they are called tropical diseases because they are mostly found in the tropics. In the global geographical locations we call tropics. Unfortunately for us, a sizable number of countries within the tropical region are also not so developed. So it's suspected that a number of competing interests on other health-related issues also brings in the reasons why some of these diseases that require some interest are being ignored. But thank God that the World Health Organization recognizes that and set up a system to address globally neglected diseases, among which what you mentioned, some examples you mentioned, mostly concerning the viral hemorrhagic fevers and other diseases of public health interest.
Thank you so much for that response. And you recall I did talk about malaria fever. I also talked about dengue fever. Now, our focus is not on malaria fever. However, we're focusing on dengue fever. And you'd recall just last year, December 2023, there was an outbreak in Sokoto State where you are presently. I'd like for you to, tell us about that outbreak and, just explore what dengue fever really is. And if I understand this is not the first time we're having this outbreak in the country. So you could also give us further insights on this outbreak, the present one that happened in 2023 and the previous ones in earlier years.
Dengue fever is one of the families we call the viral hemorrhagic fevers, and it's also found in the tropics. However, over the years, there are some assumptions that most of these fevers will happen, but then they happens undetected, especially in countries like Nigeria. When we go to the Southeast Asia and some Middle East countries, you find dengue a very common thing, just like the way we report malaria in Nigeria, for instance. So many people find it difficult to believe that or to even suspect a dengue at the first instance when they meet people with symptoms, because these symptoms seems to be more like those of malaria and the other commonly occurring tropical diseases. That gives the challenge that people, clinicians hardly think of dengue at the first instance. And even when there are some excess of cases of this malaria, some places they said we are having a severe form of malaria, we are having some other diseases like typhoid and what have you. Dengue, it is the 2023 is definitely not the first time we are seeing dengue in Sokoto, because I was really part and parcel of the team that handled the outbreak of dengue in Sokoto far back in 2016, where a number of deaths happens. So I cannot see the figures now, and a number of cases were really overly identified and treated. In last year, there were reported 71 reported cases, mostly from Sokoto North, South, Wamoko, and the Gishuni local governments. These are part of the metropolitan Sokoto town. And even the previous cases actually happened within the Sokoto metropolis, mainly Sokoto North, Sokoto South, I remember, and some parts of Wamoko local government in 2016. Dengue fever, as the name implies, is caused by a virus called dengue virus, and this virus is being transmitted to humans via bites of a mosquito. This mosquito we call the Aedes aegypti. That's the name, as opposed to the one that transmits malaria, that is called Anopheles mosquitoes. These mosquitoes, of course, they live around us, and their characteristics are quite different from that of the Anopheles. And then the time they also come out and have bites is also early night, early evenings, and early mornings, as opposed to the good night friends, a bad night friends of ours, the Anopheles. Well, the sign and symptoms of dengue is similar to that of malaria. You have fever, you have headache, you have vomiting, some generalized body weakness, and even some rashes sometimes. And unfortunately, a number of people will have the dengue and they will go symptomless. They will not even have symptoms. And even those with symptoms, they are more likely to clear it with good management. And so a number of cases of dengue will pass undetected. Few that will develop symptoms can really become severe because of the way dengue virus happens. As a viral hemorrhagic fever component, it affects the immunity, human immunity so much, such that your body will not be able to fight other competing diseases and exposes you to become ill and probably leads to death in severe cases.
You have talked about how this dengue fever somehow mimics malaria fever and also, say, typhoid fever, so much so that so many people may not be able to differentiate between which of the fevers they're dealing with. But then you've also mentioned the symptoms. You've mentioned, you did say that some cases of people coming down with dengue fever may not even have symptoms. Now, my question to you now is, if they are not presented with symptoms, how then do they detect? How then do they know that they have come down with dengue fever? So I'm talking about diagnosis now. It's Is it something that it now has to do with the medical practitioner? They have to take themselves down to the public health center, and then the diagnosis will be done? Or I just want to know the dynamics around finding out what particular fever this is, and if it is dengue fever, and then before the disease center, the Center for Disease Control, now goes further to say a lot of people have come down with this particular disease, and it is now an outbreak in this location or in this state.
What typically happens is those people who will develop, does not develop symptoms, you don't expect them to go to the hospital for them to even report that they are sick. And for those that develop mild illnesses, they only go to the nearby health facility also and take some medication. That I'm having some body pains, I need to take some medications to cure my body pains. Some will even attribute it to a recent activity they've done. Maybe they have traveled also. Those that will develop symptoms, as they arrive at the hospital or facility, as usual, the doctors will see them, or the health worker will see them and listen to their complaints. It is their ability to describe their signs and symptoms and the extent of the information they are able to deliver. Is what is going to guide the health worker to identify what investigations he or she requires to complement the information he has gotten from the patient to get into a definitive diagnosis. So is the information gathered and the observations, or what happened, the reports that the health workers are able to generate and share with the public health system. That's what will lead to the high level of suspicion that could this still be malaria or something else? Like in last year, as you mentioned, one of the things that brings out the suspicion was that so many people complain that they have malaria. They are diagnosed. They've been diagnosed for malaria. They've been treated with the conventional treatment, sometimes even injectables, and then followed by the oral treatment, and then the body weakness, the fever are not going. So the health system was like, we made some calls to the public health personnel in the state that, look, are we sure we are dealing with malaria, or is something bigger than malaria? Because of our experience in 2016. And then some samples were taken and say, wow, this is dengue. You remember about 13 cases were confirmed by the NCDC and say, wow, this is dengue. So these are the dynamics. Those without symptoms, they will hardly go to they will not even go to the health facility. Those with symptoms, mild symptoms, they are more likely to get treated at the health facilities or even pattern medicine stores with some analgesics, because they say, well, I think I have fever due to hard work or so, and they get treated. Some will even be treated for malaria and they go. They need over time, maybe they get cured because of mild forms of dengue. Some will have the severe symptoms and definitely will get to the health facility. And the number of information they are able to provide to the health worker, that's what will guide the health worker to have a high index of suspicion and say, wow, could this be malaria, or could this be bigger than malaria? Okay. Are we dealing with dengue? We are dealing with yellow fever. We are dealing with typhoid fever also. And then the overall health system, knowing that, will guide in taking the samples and moving forward to get to the diagnosis.
Dr. Bello, if I may, you and I understand the role of prevention in any disease, and this cannot be overemphasized. We're talking about dengue fever now. I understand that for malaria, there has been tests for vaccines across African countries, and some have even been approved in Nigeria, especially for children. I'd like to know the role of, is there any similarity for vaccination, say for dengue fever, since we have established that it has almost the same symptoms with malaria? I just want to know the role of vaccination and other preventive measures?
When we talk about prevention of dengue fever, we really have to look at it in the angle of things that are really feasible as at today and the level of science. One is transmitted by mosquito. So anything that we can do to prevent contact with the mosquitoes, that is a major thing that we should do, including manipulating our environment to avoid the presence or thriving of these mosquitoes, especially the Aegypti. Then secondly, it's of note that we do little when it comes to dengue in terms of treatment, because we don't have like any definitive treatment for dengue. So always we do in the health facility, we do palliative. I mean, we do some fluid therapy, and also encouraging patients, managing the fevers and what have you. Then we talk about the communities, roles of the community engagement, and creating awareness to the people that, look, you should not allow yourself to be bitten by these mosquitoes. And whenever you have somebody with sign and symptoms, you should rush him to the hospital for immediate assessment and probably diagnosis and management. And then we talk about in some countries, there are instances whereby the mosquitoes are being genetically modified and released to the forest, so that there will be decrease in the number of mosquitoes being produced that have access to the populace. And when it comes to vaccine, I knew so much that a lot of research is still ongoing in seeing to the development of dengue virus vaccine. The last time I know is still under development. I'm not aware that vaccine is now released for field trials or for the public use.
No,
so what other things that we need to note is...
I mentioned earlier was for malaria, not for dengue fever. I was just asking for you to clarify for us if there is any of such for dengue fever.
As at now, I'm not aware that there is any approved vaccine for dengue fever.
Okay, now, so let's just look at Sokoto State as a case study. You did mention that there was this outbreak in 2016 where we recorded more cases and more fatalities. And now it also resurfaced in 2023, December 2023. I'd like to hear from you personally as someone who partook in 2016 to help eradicate and control the disease in the state. Now, I'd like to know the state of this disease in Sokoto State presently. Would you still say there's an outbreak? And if it's no longer an outbreak, what position is the disease in the state at the moment, and what is the response so far?
Well, as academics, I'm a public health person. I also follow the state health system carefully and observe what is being done. I can remember that as at 2016, one of the things that was discussed is our ability of the health system to quickly catch the disease when it happens. And we even worked towards getting some diagnostic kits from Malaysia to be able to pick this disease whenever we have a suspected case. And as at today, the Ministry of Health, I have discussed this, and they are able to bring out some public awareness system, and also make a statement that as at November, December, there is an outbreak of dengue, which as at now have subsided so much that we don't really have such cases being suspected as at November, December. So, and I believe because of the nature of the disease, by this time around, the mosquitoes are not as common as it used to be during Harmattan. compared to during the late rainy season and during the rainy season. So this is what I can definitely say about the current situation in Sokoto.
Earlier, Doctor, you did mention how it is pertinent for every citizen, especially in Sokoto State, since that is our focus, to try as much as possible to prevent themselves from allowing these species of mosquitoes biting them before it may later develop into dengue fever. Now, I'd like to hear from you personally. What do you think should be the measures we should put in place for better health practices, just so we don't expose ourselves to these mosquitoes and then we're later having the cases of dengue fever or malaria fever or typhoid fever or any other kind of fever?
Yes, whatever prevention we talk about, it has to start from me and you. I mean, the populace themselves. Our environment needs to be really clean and not really suitable for mosquitoes to thrive. That is very necessary and timely. We need to do that. And then, of course, our personal practices, staying outdoors, out covering our legs, covering our hands, exposing our body parts for mosquitoes to bite us. But the environmental sanitation hygiene is key and the most important thing. Because if the mosquitoes are not there, then you'll be free of any personal responsibility, because the mosquitoes will not bite you there because they don't exist. So we as individuals have to take full responsibility of protecting ourselves by protecting the environment, keeping the environment clean. And then other things like sleeping under mosquito nets, wearing long sleeves when we're outdoor, and also when somebody is sick, it should be taken fully care of.
We have seen cases of malaria that are fatal in children. As a matter of fact, children account for a high number of cases of malaria death, especially in African countries. Now, let's say for dengue fever. Now, how fatal is this particular disease?
Pardon?
For dengue fever now, how fatal is this particular disease?
Interestingly, on the lighter note, dengue is not as fatal as malaria, especially here, based on our observations. But it still can also be related to the fact that many a times the disease is not fully identified early. So it's possible that the numbers are more than what we really see, only that we don't have the full figures, full picture of the disease. Paternity in this setting, and not really in Sokoto alone. I'm sure in most parts of the country, some of the things we treat as malaria or severe forms of malaria are likely to also be dengue. Only that the country needs to buckle up and really sit up to see that, yes, as we have the diagnostic capabilities across the country, so that we detect this disease early and treat the patients. And in not all cases of fever are malaria.
Just lastly, before we let you go, I'd like for us to explore treatments. What is the role of pharmaceuticals for treating dengue fever? Because we have seen cases, I keep talking about malaria and dengue fever, because we have seen cases where pharmaceuticals play a huge role for treating malaria. So I want to know that for dengue.
As I said earlier, we cannot say that, okay, this is definitive treatment, this is antiviral, that when you give it to a person suspected of dengue is cured. No. What happened is, for instance, when you have the dengue and it develops, you have challenges with your immune system, you have challenges with the fluids in the body. So, and that is what is being monitored over time to see that you are progressing in getting better. You needed things like bed rest and so on and so forth. I think one of the things that the pharmaceuticals can do for us is to contribute significantly to research on the existence or otherwise of dengue fever in Nigeria over time, and also come up with the diagnostic kits, support the development of locally made diagnostic kits. I know there is currently a research and a developmental research going on in Sokoto, for which I'm a member of the infectious disease committee of Usman Danfodio University, Sokoto, and there is a diagnostic kit being developed in collaboration with other partners in Europe and in Germany, and so on detecting what we call fever of unknown origin. Because it's observed that so many fevers will come and then we just treat them as malaria. So we are working on the project to bring out a diagnostic kit that can aid in detecting that, okay, this fever is not malaria, is this or that, an array of diseases that are likely to cause fever. Well, I don't have the permission to talk much on this area because I'm a member of the committee. I didn't know that this type of question will come up, but I'm just giving you an insight that something very big is happening in Sokoto, Usman Danfodio University, under the leadership of the current Vice Chancellor, Professor Suleiman Bilbis, and the Infectious Disease Committee.
I'd like to hear your final words on this disease. Just your final words to the public and also to public health professionals. Just very quickly.
Public health professionals should do more on researching dengue fever in the country. The people should also note that prevention is better than cure. We have to take charge of our health, and if we have to take action, we have to take action now.
Okay. Thank you so much, Dr. Bello Arukela Magaji, a senior lecturer, community health, Usman Danfodio University, Sokoto. Thank you so much for your time. This is the much we can take at the moment. We do hope to reconnect with you in subsequent episodes of the program to have your thoughts. And that concludes this week's episode of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on YouTube, live stream, and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I'm Aisha Salihu. Thanks for your time.